Good morning. Thank you for attending this talk. My name is Dr. Alison Bentley, and today I'm talking about the impact that a child's sleep problem has on the parents. I think many parents feel guilty in trying to resolve their children's sleep problem and underplay the impact that the sleep problem is having on their lives and their sleep. Often people will say, but it's part of motherhood, that we put up with this kind of sleep deprivation. Really, the idea of this talk is to show you that there are significant medical consequences to not getting correct sleep. It's not meant to terrify you at all. It's meant to just expose you to some of the consequences that may occur to adults who don't have enough sleep. And I would really urge you to take cognizance of them and to think about them when you are thinking about whether you should take action for your child's sleep. So the talk is titled, Your Child Needs to Sleep Well for Your Health, and that is for the parents' health. So let's look at some of the consequences. Now, initially, we would think that this is just sleep deprivation. So, for example, if you have a looming deadline, you start using caffeine, stimulants, both legal and illegal. Many of you don't use illegal, but you get very irritable, you get paranoid, you go a bit loopy, think you're going a bit crazy. Don't look quite right, and then get dead tired. Now, we can dispense with one of the issues immediately, and that is humans do not die from sleep deprivation. They might die of the consequences of sleep deprivation, but not the sleep deprivation itself. So there's no question that if you're sleep deprived and you're falling asleep while driving, you can die from that, but not from the actual sleep deprivation. So let's not worry about that. But there are other consequences. Now, we know about insomnia and we know about sleep deprivation, and you would tend to think that this is just about sleep deprivation and doesn't really fulfill the criteria for insomnia. Well, I hope to prove you wrong on that right now. So there's three different types of insomnia. One is acute, the other one is insomnia disorder, and the other is secondary insomnia. So acute insomnia, I'm sure you've had fairly often. That is exams, for example. During varsity, you might have lack of sleep during the exams. And then as soon as the exams are over, you are able to sleep quite well. Environmental causes would be babies waking you up, but also would be when it's very cold or when it's very hot. If there's a lot of loud noise, I'm sure you can identify with that. Now, in the acute insomnia, there's no question that if the stress is short enough and with little emotion involved, such as exams, 75% of people will go back to having normal sleep as soon as the stress is over. 25% go on to chronic insomnia. So one of the consequences of having disrupted sleep from any cause whatsoever is that you can have chronic insomnia. Now, how do we define that? This is the DSM-5 definition, and so this is the psychiatric handbook that we use to define insomnia disorder. And this is the definition, and I'm sure that you will identify with many of these things as we go through. And at the end of it, you'll be convinced that you might have insomnia disorder or secondary insomnia. So there's a dissatisfaction with sleep quantity or quality. There's difficulty maintaining sleep, characterized by frequent awakenings or problems returning to sleep after awakenings. The sleep difficulty is present for at least 3 months. The sleep disturbance causes clinically significant distress or impairment in social, occupational, educational, academic, behavioral, or other important areas of functioning. This is talking about your functioning during the day. So there's an impact of sleep deprivation on your daytime functioning, and the sleep difficulty occurs at least 3 nights a week. The sleep difficulty has to occur despite adequate opportunity for sleep, and that is you go to bed at the right time to get the right amount of sleep. But for the definition of insomnia disorder, there can be no other sleep disorder, medical condition, or substance abuse. If there is, then it's not called insomnia disorder, it's then called secondary insomnia. So in the DSM-5 definition, it's called other insomnia. Secondary insomnia makes more sense because it's caused by something else. Insomnia disorder is where it's caused by nothing and it's just a self-sustaining independent disorder. Secondary insomnia is what we're talking about here. So you have a baby, wakes you up constantly at night. They are the cause of your insomnia at night. So yeah, this is insomnia. You have chronic insomnia if your baby has been waking up more than 3 nights a week for more than 3 months. So what are the consequences? So firstly, long before you get any significant consequences, you get a drop-off in executive functions. Now, these are functions that make us different to all other animals. So things like appreciating a complex situation and avoiding distraction, keeping track of events and updating strategies, thinking laterally and being innovative, the ability to remember an event sequence, and effective communications. These are compromised during the day. Now, I'm sure many of you have jobs in which you get paid for this, for innovative thought, for thinking laterally, for ability to remember where you are. You get paid for this, and it's compromised if you're not sleeping well. More importantly is that when you're not sleeping well, you get the same kind of consequences as when you take alcohol. So assessing the risk and anticipating range of consequences, remember these are compromised. Maintaining interest in outcome, controlling mood and uninhibited behavior, and showing insight into one's own performance. And this is critical for alcohol, because the reason why you should not drink or drive is not only are you not able to assess the consequences correctly, but you don't care about the consequences, and you also have no insight into how good you are at actually being able to do the task that you're supposed to do. So when it comes to driving, you don't know that you're compromised, you don't care that you're compromised, and you don't know that there are going to be consequences. And the same thing happens with sleep deprivation. So that is why you should not be driving, for example, if you're sleep deprived. What about errors and accidents, seeing as we're talking about driving? So yes, errors, incidents, and accidents, they're just degrees of the same thing. So an accident is an error that occurs in the wrong time in the wrong place. So let's talk about driving, and let's talk about fatigue-related collisions. This graph on the right can be constructed for every country in the world. For fatigue-related collisions, there are two peaks, one at 2 o'clock in the afternoon, and that's that after lunch dip that I'm sure many of you experience, and then 2 o'clock in the morning. What are the characteristics of a fatigue-related collision? Usually single vehicle accident and no skid marks. So people fall asleep, don't know they're going to have the accident, and tend to just drive off the road or go across the median of the highway, for example. So what is the data that we have is that if you have insomnia, chronic insomnia, you're 2.5 times more likely to have an accident, either driving or in the workplace or at home. If you have sleep apnea, which causes sleep fragmentation, then you're 8 times more likely to have accidents. Not inconsequential events that occur because you haven't slept well. What about the psychological consequences? So let's look at pain. So approximately 25% of any population has chronic pain, particularly older patients. 15% have insomnia or sleep deprivation. And I'm sure it's very logical to you that if you have chronic pain, that you are very likely to have insomnia because of the pain. So over half of patients who have chronic pain, so for example, rheumatoid arthritis, are likely to have insomnia. But I don't know how many of you knew that if you have insomnia or sleep deprivation, that fully 50% of those people will get pain. And it's a muscular kind of pain. So the kind of pain that you get when you have flu, so general muscle aches and pains, pains in your neck, pains in your back, it's that kind of pain that you are susceptible to. And we call it hyperalgesia. It's an increased perception of pain. Now, the easiest example is when you have sunburn and your skin is very sensitive even to touch. So if you touch your skin and it's painful instead of not being painful, that's called hyperalgesia. So that's what happens if you don't sleep well. What about medical disorders? Let's look at depression, for example. So there are many examples that we can give you of this interaction between sleep and other medical disorders. No question that if you don't sleep well, and I'm sure many of you who are not sleeping well now know that you're grumpy during the day, you have depressive symptoms. Do you have clinical depression? No, but you will have depressive symptoms. We also know that if you do have clinical depression, 70% will have insomnia as a symptom of the depression. Sleep disturbance is a key symptom in all of the questionnaires about depression. But maybe you also didn't know that if you have insomnia from any cause whatsoever, you are 4 to 8 times more likely to have depression for the rest of your life. You have an increased risk of depression. If you have chronic insomnia, and that in this particular study, it was defined by insomnia for a year duration, then you are 40 times more likely to have depression. This is a really good reason to get your child's sleep sorted out, that you don't have an increased risk of depression in the future. And obviously, if you have depression, it has a negative impact on everything from then on, and then requires its own treatment. So we'd rather not create depression if we could possibly avoid it. But let's get into the big medical disorders. So let's look at the cardiovascular system. If you have less sleep, you get changes in the autonomic control, and by that we mean the sympathetic nervous system, which is flight and fright, and the parasympathetic nervous system, which is rest and digest. You're much more likely to be in a fight and flight kind of situation. You're not meant to be like that 24 hours a day. There's inflammation, there's immunity responses and metabolism that can increase the risk of cardiovascular disease. If you do shift work, and we know that in shift workers their sleep is compromised for years, there's an increased risk of cardiovascular disease. There's also an increased risk of hypertension, so 8 times more likely in night shift workers and rotating shifts, people who work rotating shifts. And then short sleepers, usually defined as 5 to 6 hours or less, have up to a 50% greater risk of coronary heart disease and mortality, and a 15% greater risk of stroke. And so if you have come from a family with a family history of heart disease, then you don't want to be sleep deprived for long periods of time, because that increases, again, adds to that risk of cardiovascular disease. What about your weight? The graph that you can see in front of you on the right-hand side is 40-year-old people, and shows very clearly that as your sleep duration goes down in hours, so towards the left, so you drop your duration down to less than 5 hours, then your body mass index increases. And so 28, which is just at the end of this, so less than 5 hours at a body mass index of 28, that's just on the edge of being overweight. And so just sleep on its own without any other factor, all the other factors taken into account, just short sleep on its own increases your risk of being overweight. In another study that was done in 29-year-olds, showed that if you have short sleep duration, and this was less than 5 hours, that your risk of being obese is 8 times higher than people who sleep well. And previous obesity would be 5 times, that you're 5 times more likely to have been obese if you have short sleep. And this occurs in adults and it occurs in children as well. And why does this happen? So multiple factors, but they really can be divided into just a few common threads. So there are 2 hormones called leptin and ghrelin, and one of them, leptin, gives you a sense of being full, and ghrelin gives you a sense of being hungry. And they go in the wrong direction. So leptin is down, ghrelin is up, and so you're in a state of increased hunger all the time. I'm sure you felt that when you're sleep deprived, you're looking for calories, for energy, tend to get them in chips and biscuits, not salads. If you're awake for longer, you tend to have an increased opportunity to eat. So I don't know how many of you, if you get woken up at night by your child, before you go to bed, you go and have a quick glass of milk or a biscuit or something. And so there's an increased calorie intake. Along with that is a reduced energy expenditure, both from altered thermoregulation, so your basal metabolic rate, which burns most of the calories during the day, is lowered, so you don't burn as many calories. And then because you're so tired, you don't exercise as much. And that's a very bad combination. So an increased calorie intake and a reduced energy expenditure is likely to lead to obesity. So not sleeping well is likely to lead to you putting on weight. What about immune function? And maybe you've had the experience of, during varsity, for example, of having exams, particularly in July, and then spending the next 3 days in bed with flu afterwards. But we certainly have been able to link a shorter sleep duration, again, either 6 or 5 hours of sleep, to an increased likelihood of catching a cold. We certainly were interested in this when it came to COVID, that the risk of getting pneumonia was 70% higher if you got less than 5 hours of sleep, and that if you were sleep deprived and had a vaccination, that you had a lowered antibody response to that vaccination. So for parents, that's important for COVID vaccines, for example, but for your children, it's also important that if they're not sleeping well and they go for their vaccinations, that they're less likely to have a good antibody response, and therefore the vaccinations are less likely to work as well as they should. So the graph again on the right-hand side shows the solid line, which is the patients with insomnia, the dotted line with patients without insomnia, and you can see the increased risk of getting pneumonia in those people with insomnia. This is over 11 years. So the point is that, the ongoing insomnia continues to produce an increased risk. So in conclusion, I hope I've managed to persuade you, it's been a very short talk, that there are significant consequences to having interrupted sleep for an extended period of time. This includes daytime productivity, concentration, and function. And I think many of you feel that you're not the parent that you wanted to be. You're grumpy, you don't have the energy, you don't want to play as much as you wanted to before you had children, maybe. That your increased likelihood of having pain and depression, that your cardiovascular system is under strain, you're more likely to put on weight, drop in immune function, and that the insomnia you have from your child waking up all night may develop into chronic insomnia. So please, again, I'm just going to stress this. This is not meant to scare you at all, but just to inform you that there are significant consequences to you not sleeping well. So please to do something about your child who isn't sleeping properly if they are older than 6 months, because your health is at risk. No question that their health is at risk, and I'm sure there are other talks that will deal with that topic. This is about you. You are not being mean and you are not being inconsiderate in wanting your child to sleep well because you are compromised. Thank you very much for listening, and I'm happy to answer any questions.